The role of the hospital chaplain is central to true healthcare. There's something about the healthcare chaplain's role is to attend to all the needs that are beyond the medical, what it is that makes a person a person. And so many people came into healthcare with the view of making people's lives better, and sometimes it doesn't feel like that. It can feel like it's just doing task after task, and the healthcare chaplain comes in empty-handed, offers true presence and willingness to hear the whole person beyond the illness. The last 2 years for healthcare chaplains in particular have been difficult because at one domain there's the PPE and restrictions and the changes of hospital systems and services, but also because they're human beings, and I don't think there's any human being over the last 2 years who hasn't been significantly affected by coronavirus, its effect in the workplace and in the home, and actually just globally. So I think it's been particularly difficult, a particularly difficult time for all humans, and that healthcare chaplains are part of that, but actually attending to the spiritual needs of people during a pandemic, being perceived as an important thing has been helpful.
I think we've had a very good presentation of the importance of spiritual nourishment and spiritual care when people are in a hospital setting. I mean, people immediately associate coming into hospital with getting their physical diagnosis and their physical recommendations, but what I was learning today is just the very professional way, but professional in a way that doesn't lose any of the personal empathy of identifying what a person's spiritual needs might be, obviously with that person's consent, and then trying to find ways in which that can be addressed, because if you're going to treat the whole person, it's the spiritual as well as the physical, and I could not help but be impressed by what we learned as to how we go about their work. I think it's very important to give a message that the work they are doing is so much appreciated and so much valued. They've been through a very, very difficult time. It's never an easy job, but the last 2 years, as we well know, have been tremendous pressures. And I think what was interesting to learn was not only the healthcare chaplaincy towards embraces patients, but also the work that has been done with members of staff who've been working under tremendous pressure. And it was very interesting to learn that a particular member of staff had, because of the support that she'd had at a particular time of crisis and difficulty in her work, she was then able to identify when a patient had spiritual needs, and was able to then to go to the chaplaincy and say, look, this person has spiritual needs, can you come and help? And it did seem to see that completed the circle, and the patient was able to help and by all accounts received some very important support at end of life, in an end of life situation. But that happened because the member of staff herself had earlier received chaplaincy support.